Good afternoon, I'm Douglas Searle. I'm the Director of Health and Safety for the University, and this afternoon I'm going to be answering some questions submitted by students and staff on coronavirus or COVID-19. So the first questions that we have are around hygiene and similar matters on campus. So the first one is, what are we doing to minimise the risk? Why aren't we providing hand sanitizer? The simple answer is that the government advises washing hands is the most effective way to stop the spread of this disease or any other disease. Hand sanitizer is recommended only where there isn't somewhere that you can wash your hands with hot water and soap. On campus we have a large number of places where we're able to wash hands, and therefore that's what we're encouraging people to do. We don't want to encourage people to use hand sanitizer which isn't as effective, as in most cases it's antibacterial and this is a virus. So another question around this was drying hands. People have asked about things like towels and hand dryers, and while it's true that hand dryers can spread diseases, as I think most people can appreciate, that it's quite difficult to get hold of certain items at the minute within the UK, and one of those is paper hand towels. We do have a supply on campus, but we are saving those for if the situation changes, and if it does, then we will not hesitate to use them. So there's also been a number of questions around social distancing, personal space and the cancellation of various events. So basically at the minute the advice from the government is that this is business as usual. While they're moving into the delay phase, that's not where we are within Royal Holloway currently. So we are continuing to teach our students and provide activities as we would do usually. We can of course always change this at very short notice, but again at the minute we don't believe that that is proportionate. In terms of social distancing in space, the advice from the government is that you must be within 2 metres of someone for at least 15 minutes to be considered a close contact, and for the majority of us, the majority of the time, that isn't the case, and including during lectures. Large events we will continue to monitor and look at, and we will take the advice of the government in terms of cancelling these events as and when we have to. We've also had a number of questions around public transport and travelling into the college and whether people need to be concerned. The advice is at the minute that no, you don't. It's perfectly safe to use public transport as you would do normally. However, if it changes and the government gives us additional advice, then clearly that will change. There's also a question around face masks. The UK government is not advising the use of face masks at the minute, although again this may change. Culturally, some people do choose to wear face masks, and that's absolutely fine. It's a matter of personal preference and social responsibility in some cultures, and we would of course support any of our students or staff who chose to do so. So this next question is probably the one most commonly asked at the moment. What should I do if I'm asked to self-isolate? I think firstly it's important to understand what self-isolate means. It's a fairly common medical term, and in fact is often used if someone has seasonal flu or a cold. It essentially just means stay out of other people's way so that you don't risk infecting them. In this specific case, self-isolation is something that a medical professional, NHS 111 or Public Health England will advise based on you meeting the 3 symptoms: fever, cough or shortness of breath. COVID-19 isn't just general cold and flu-like symptoms, it's got to be those specific 3, and if you therefore have been to a location which is judged as high risk, if you've had contact with someone confirmed as having the coronavirus, then if you have these symptoms you may be asked to self-isolate for 14 days. People shouldn't decide to self-isolate themselves just in case or because they think it might be helpful. The important thing is to follow the advice given by NHS 111 because they're also involved in tracking the virus and its spread. So report to them if you're worried, they will certainly give you some advice, and then you can self-isolate if advised by them. The other question around this is people who are worried, should they work from home, should students not attend lectures? So at the minute, this is business as usual. We're continuing to run the college as we have, we're continuing to run the teaching that we provide our students. There is a balance in all of this between risk and in providing the education that many of you came here to get. It's important to us that you are all safe and that your well-being is looked after, but it's equally important that you get that education. So at the minute, the balance of the risks is that it's business as usual, please attend your lectures. We've also had a number of questions around travel, especially with the Easter break coming up. Specifically, the first one being people who are concerned that their flatmates or their friends are travelling within Europe or the rest of the world. This is of course their decision, and the university isn't able to influence people's personal choices, and nor would we want to. However, we would say that if you are planning on travelling, please check the Foreign and Commonwealth Office website, which gives the latest information on their advice for travelling to these locations. This is good practice even outside of coronavirus. However, specifically at the minute, it will tell you if there's any outbreaks in the country or where they are. The other part of this is that you also have to be aware that if you do choose to travel, you may be required to self-isolate on your return. And please bear this in mind when you're planning your travel, especially if you have exams after the break. The university can ask people not to sit exams if they are unwell, and although we would clearly not like to do so, we would potentially have to make that decision if the situation arose. If you are concerned about your flatmate or a friend who's travelled and returned, just please ask them to call NHS 111. They'll be able to look at the location specifically, discuss any symptoms they may have, specifically the 3 symptoms of COVID-19, which is fever, cough and shortness of breath, and if required, they will ask them to self-isolate. We've also had a number of questions around field trips, and the answers are pretty similar to the ones I just gave on personal travel. The university will check the Foreign and Commonwealth Office website to make sure that the place that you're travelling to is safe and that travel is advised. If it's not, then we'll simply cancel the trip. Assuming that it is, it's business as usual, and we will travel and complete the field trip as we would usually, although we may change some aspects of it, such as the means that we get there and any additional or extracurricular activities, just to ensure that the risk is as low as it possibly can be. We've also had a couple of questions around visas, which I'm not necessarily best placed to answer, in that my job is health and safety. However, as I've said, we're currently in business as usual. So if you choose not to come to lectures, then that would be regarded in the same way as it would be normally if you didn't come to lectures. There's also been some questions from students around having to self-isolate if they do return from travel. Clearly, if you return and having called NHS 111, you're told to self-isolate, then you would be expected to do so, and the university would understand this, and it would be an authorised absence. And if that affected any assessments or exams, then these would be clear extenuating circumstances that would be covered through the usual processes and procedures by the college. We also had a question around if you have been asked to self-isolate, but if you feel fine, can you come back into university as normal? And the answer to that is no. There is information that suggests that this illness is significantly less severe in the young, and especially those under the age of 20. In fact, you may not be aware you have COVID-19. The symptoms could be so mild. That doesn't mean, though, that you're not infectious, and we absolutely want to safeguard all of our students and staff. So if you are asked to self-isolate, please self-isolate. So the final question is around what would we do when the situation changes. The college has a robust and tested emergency response team who are able to deal with a range of situations, including this. A great deal of work and contingency planning has gone on in the background of the college to ensure that any disruption to students or staff is minimised, and that work will continue as the situation changes. So finally, if there's any questions that you still have after this short video, if you're a student, please email supportingyou@royalholloway.ac.uk, and if you're a member of staff, then please just contact me. Thank you.